This short video will give you some useful information and guidance about what to do when your child has a fever or high temperature. Fever or raised body temperature is very common in children and is usually associated with an infection. However, in children, most are caused by viral infections, which usually get better on their own within about 3 to 5 days. Fever is actually a normal part of the body's response to an infection and is actually a good sign as it improves our infection fighting ability. However, it can make children miserable, and this as parents is concerning and can be difficult to watch. The key thing with fever really is how is it affecting the child? For example, are they able to still play as normal, feed as normal, or is it causing them difficulty breathing? Are they difficult to wake? Have you noticed a rash that doesn't fade when you attempt the glass test? Or are they having a seizure? We can see quite well looking children with temperatures of 40 degrees, or we can see children who are really quite sick with temperatures just above 38 degrees. So the height of the temperature in itself alone is not an indication of the seriousness of the infection or the illness. However, it is important at all times that if your child looks unwell, that you watch very closely for any amber or red features which are listed in the Children's Symptom Checker and seek appropriate medical advice. This might be from your GP or your nearest emergency department, because we know sometimes fever is associated with more serious infection such as sepsis, pneumonia, urinary tract infection, appendicitis, or meningitis, to name a few. It's worth mentioning that if your baby's under 3 months and has a fever over 38 degrees, this is considered a red feature and could be a sign of a more serious illness. So we would recommend seeking urgent medical attention and attending your nearest emergency department. The baby will require further testing and likely a period of observation and possibly a hospital stay. Babies, however, do often develop fever within the 24 to 48 hour period after having their vaccinations, and if they remain well, this is not a cause for concern in itself. However, if you have any concerns or worries about your baby, it's always safest to seek medical advice. When your child has a fever, there are some things you can try to make them more comfortable. We suggest offering cool drinks or ice lollies, and also ensuring that they're wearing appropriate light clothing so that they're not overdressed or overwrapped or indeed underdressed. And if the child is distressed by their illness or the fever, then we recommend giving some paracetamol or ibuprofen, which are over-the-counter medications. For fever advice sheets and further information, please visit the Children's Symptom Checker on the Belfast Trust website. You can also seek advice from your health visitor, your community pharmacist or your GP.